So today on the Ortho Perspective, we're joined by Preston Alexander. And I know a lot of you out there have probably read some of Preston's stuff. And so after Preston got an MBA, he went on to work in med device. He worked for companies managing over $100 million in business. He started his own med device company and sold it. And now kind of Preston's passion is to help others start companies, build their businesses, and move into non-clinical leadership. And I'm thrilled because every Sunday, Preston personally sends me an email breaking down the economics of healthcare. I'm sure I'm the only one, right, Preston?
Just you.
Yeah.
Yours
So,
too.
welcome to the show, Preston.
Thanks for having me. I really appreciate it. Thrilled to be on, and thank you.
Yeah, absolutely. So, one thing that I've become or come to realize over the past few years is that the money in healthcare is enormous. And what I mean by that is you have large med device companies just making what seems to be more and more money every year. Insurance companies, same thing. And even some hospital systems, yes, there's some hospitals struggling out there, but the hospital systems, the big ones, seem to just keep making more and more money. So kind of help me understand, how did we get to where we are?
Well, I think that's definitely a big question. But I mean, I
Yes.
think that from just in simplest terms, from like a macro standpoint outside of healthcare, I mean, we got where we are largely based on I'd say it's more of a, maybe a sociological or just like social perspective. Our economy has always been a capitalist economy, that regards profit and money as sort of the ultimate good, right? Like we ask if someone's successful, what do we mean by that? We always mean how much money does that person have? How much money did they make? Are they successful? So healthcare was ripe for that sort of arena to jump into and make as much money as possible because it's the most inelastic economy there is, meaning you're willing to pay anything, and you have no choice. If you have a heart attack, what do? An ambulance comes, they take you to the hospital. You can't even, you'd
Right.
pay whatever you could, but you don't even have a choice and you have to pay it. So, what an opportunity for a market for people to come in and maximize their revenue and profit. And I think that, there's a lot of things that went into that. I mean, we can talk about the politics and policy and legislation and the administrative burden to deal with a lot of different things and the nuance. But I think ultimately, it's just that macro perspective of how our economy works.
Yeah. So my second question is you every Sunday have a newsletter that you send out. I forget, I mean, you've done like 40 or 50 of these newsletters to date, I believe. What kind of drove you to do that and to break it down for us that may not be as understanding of a balance sheet or the way they report income, etc.?
Yeah, it's funny because I mean I was just writing on LinkedIn about a lot of different things. Hadn't thought necessarily about doing a newsletter, and then someone commented. I just put some like sort of a summary of some financial performance of a hospital, and I think it was Ascension last year that they had claimed they lost $1.7 billion, but their cash statement said that they actually made 1.7 billion in cash, and I was like, let me break this down. And it just like that terminology just came up. People started calling it a breakdown. I was like, really liked it. And I was like,
Yeah.
and also seemed not to understand the mechanics of it. So I was like, maybe this could be a newsletter just to, because like you mentioned, my passions really become, and my LinkedIn headline is like unlocking more clinician entrepreneurs, because I think that we're way out of balance in healthcare. More business, less medicine.
Mhm.
And who knows better and sees more than our clinicians. They can get into the business entrepreneurially or leadership wise. I think we'd all be better off. So I just started writing to that group and say, hey, this isn't as complicated as they want you to believe. Hey, don't go get an MBA, just learn some of the nuts and bolts. And so I just like to lay out from a healthcare perspective specifically. We're not talking about like, reading Walmart's 10K. We're talking about like your hospital, your facilities, your device companies. I hope it can be helpful, especially to that group who wants to make a real impact.
Right. Well, I think even to go along with that is we've all seen that graph of, our healthcare expense just keeps going up and up to the right. Administrators keep going up and up to the right. Profit of med device companies, same thing. And then the physicians, both number of them as well as income, is staying flat to maybe slightly uptick. By the time you take into account inflation, it's
Mhm.
actually going down, working harder to make less. Is just all of this is extremely interesting to me about how we got to that point. And I do think that there's some sort of tipping point out there that I haven't been able to put my finger on, where when a company gets to a certain size, they stop caring as much about the patient or physician, or sorry, yeah, the patient or the physician, as what they started out to, as well as, unfortunately, the hospitals as well, because the money is just so great in healthcare.
Yeah, and I will say too, I mean, to your point about looking at that physician income line, it has been a sort of flat or steady. Maybe you can argue that it hasn't kept up with inflation. Um, Salaries, this is just an interesting point. So salaries of physicians across the board, from specialists to primary care, all the primary care is the bottom of the barrel in terms of finance, um, has grown, but reimbursements have declined over
Mhm.
time. And that creates a really dangerous dynamic because
Yes.
inpatient hospital facility fees, those are all growing year over year. Medicaid keeps bumping up those fees, and physician reimbursements getting cut. So while this like whole narrative of doctors are making too much money keeps raging on, well, reimbursements actually getting cut, which is frankly hurting the the whole entire healthcare um, economy and industry and ecosystem, and hurting patients because physicians now have less and less choice and opportunity to be independent, and they're linked inextricably to large health systems, which we know, like HCA and Tenet and everybody else, those are the for-profit ones. The nonprofits do the same thing. Their intentions are to cut costs and maximize profitability.
Right. And so, I mean, what it seems on the physician side is they're stuck. They have to play by those rules or drastically do something different, like Daniel Paul is doing, and more of a
Mm-hmm.
concierge medicine, catering to people with the high deductible plans that, healthy families aren't going to hit. So they'd rather pay stuff out of pocket. It's a very interesting and fascinating situation that we are in. And it almost seems like, well, it doesn't seem like, is the hospitals to a certain extent are taking advantage of just the physicians on why they got into medicine, correct? A lot of them got into medicine because they want to make a difference in people's lives. And
Mm-hmm.
there is a fact, I mean, money is not bad and it can come along with the more people we help, you know, earn a living. But I think that that is taken advantage of to a certain extent because they're held to their standard, and device companies just want them to do more and more to make more money, and hospitals want them to do more and more.
Right. No, I mean, I agree. And I think it's unfortunate to say, but I mean, I talk to clinicians all the time, physicians, nurses, and I mean, we see it most poignantly in all the recent nurse strikes that have happened
Hmm.
around the country, and the, blowback that these nurses are getting from their own leadership, saying they don't care about patients, they're not putting patients first. And it's a really terrible, chip to play, but they do it all the time to, oh, you need to work two doubles because like, or do you not care about patients? Like, aren't you here to help people? And to use that against clinicians who by and large got into medicine to be,
Hmm.
for altruistic purposes, has really become, in my opinion, very nefarious and really wrong, and just underscores a lot of the issues we're seeing, and is only going to accelerate that tipping point.
Right. So let's just go down that path just for a little bit. I mean, what are ways, or how can we as a society change this? And that's a big question, just like I asked you right in the beginning.
Yeah.
But just I know part of what you're doing is just to bring awareness, educate people, because that is a big part of, we have to understand the problem. We have to understand that before we start taking action.
Mhm. Yeah, I mean, I think that there's some things we can do sort of individually and then sort of on a systems kind of level. So I like to think in terms of macro systems. So,
Mhm.
I mean, you and I are in the industry, and a lot of people listening to this are in the industry. So you're in a unique position. We're in a unique position to do more than just say, I don't know, find the right physician, go to an independent physician, do walk more steps a day. Those things that like we
Right.
say and are all great. But you know, you're an entrepreneur. I know that a lot of people on this are teetering on it or would be on it, or clinicians especially. I mean, I think that's a huge way, is that, is are we going to see drastic innovation that's going to take down United Healthcare in the next, 50 years? Like
Right.
maybe, but I don't know. But we should all be striving for that. And even those incremental wins can really make an impact. I think people are maybe in unique positions to talk to their employers, and say, who's our payer? Not even payer. Who's our processor? Are we using United Healthcare? Are we using Cigna, Aetna? Can we look at that plan? Who are our brokers? Like learning this stuff. What's the TPA? Who's actually paying for everything? Why are we all on high deductible? Are there independent health plan designers that you can go talk to? They can get you a direct contracting, direct primary care, everything deal, because we think of those things, and like what you mentioned, Daniel Paul, and like what he's doing. I know a lot
Mhm.
of direct primary care guys and gals, and we think about that on like a consumer basis, like, oh, you should go like Stu. Do you have direct primary care? But there's no reason why my employer shouldn't be contracting with a direct primary care doctor to provide direct primary care to all my employees, to all their employees, because the cost, if you look at it, is actually way lower. So there's a huge opportunity on not only the consumer side, but on the employer side too. And that's where we can really, I think, move the needle, because we talk all employers and spend, that's $1 trillion a year. It's a quarter of healthcare right there. So it's, I think starting companies is important. I think having the conversations with employers and asking yourself, do I need this type, should I go to this provider? Who owns them? Where are the independent guys? How can I, the same that we talk about shopping local, like it's being localized in healthcare. And I think those are, two kind of big ways that we can really start to make a positive impact.
Yeah. And I mean, ultimately, the kind of, I'll just say, the unfortunate thing of this is that nothing happens unless people are willing to, step out there and make drastic change. Like we mentioned, Dr. Paul. I mean, if nobody ever did something like that, then everybody's stuck in the same system. And similar to med device reps that I talk with frequently, who are frustrated, ultimately, if not enough of us are willing to step out and pursue a different path, there's no motivation for anything to change from the company standpoint. Correct? Even like what's going on with nursing shortages, et cetera, or doctors, you know if people aren't willing to do something, then there's no incentive.
Right. And yeah, I mean, I think I have this conversation with a friend of mine and mentor who's taught me a lot about systems, and it's, the individual effort can't really change things, right? Like the system dictates the output. But my opinion is that, well, people design systems, and we are the ones who really ultimately hold the key, because you can't system improve, you can't change a system, you can't create a new one without people doing it. I mean, there's
Correct.
natural laws and orders and things that we're obviously not going to impact, but the healthcare system is a human designed system. It's going to keep working the way that it's designed, and it's working very well as it's designed, even though it's not working for any of us individually. But people change it, and is it hard? Yeah, we're talking politics,
Right.
we're talking lobbyists, we're talking billions and billions of profit and really rich people who don't want it to change. But without people, it's gonna stay the same.
Correct. There are certain people in organizations that absolutely want the status quo to keep going
Mhm.
because they are very, very incentivized to do it monetarily.
Yeah.
So, well, Preston, I appreciate the brief time that we've had. If you're willing, I'd love to have you on again to talk, specifically about some of the stuff that you have in your newsletter, breaking down some health insurance companies, breaking down some hospital systems and med tech as well, because I think a lot of people would be fascinated by that. So
Yeah.
if you're open for that, I'd love to have you back. But in the meantime, if someone wants to connect with you, what's the best way for them to do it?
LinkedIn is where I am the most, just Preston Alexander on LinkedIn, or you can check out the Healthcare Breakdown at thehealthcarebreakdown.com, and you'll find me either place.
All right. I appreciate it, Preston. Have a great day.
Yeah, thanks, too. Great to be on.
Bye.